Thank you for participating in this training program. My name is Carolina Baez. I'm a primary care physician from the Dominican Republic, and I will be guiding you to this cultural competence training program. Let's get started. Instructional objective. At the end of this training program, learners will define culture, ethnicity, and cultural competence. Identify cultural insensitivity as one of the causes of health disparities. Understand how the environment affects the quality of healthcare. Give examples of best practices. First, I wanted to start answering the question, what is culture? We define human culture as a unique meaning and information system shared by a group and transmitted across generations. The emergence of human cultures coincides with the evolution of a host of complex cognitive abilities, including language and the ability to know that other people are not only intentional agents, but that they can share intentions and patterns. Culture is different from ethnicity, as ethnicity includes many individual and groups attributes such as skin color and culture, as well as group-based categories such as tribes and caste that apparently originate from a common ancestry. Clarifying concepts. What is the difference between cultural knowledge, cultural awareness, cultural sensitivity, and cultural competence? Here we're going to talk about cultural knowledge and cultural awareness. We can say that cultural knowledge means that you know about some cultural characteristics, history, values, beliefs, and behaviors of another ethnic or cultural group. While cultural awareness is the next stage of understanding other groups, it's being open to the idea of changing cultural attitudes. Here we're going to talk about cultural sensitivity and cultural competence. We can say that cultural sensitivity is knowing that difference exists between culture, but not assigning values to the differences, better or worse, right or wrong. Cultural competence brings together all the previous stages and adds operational effectiveness. A cultural competent organization has the capacity to bring into the system many different behaviors, attitudes, and policies, and work effectively in cross-cultural settings to produce better outcomes. So how can we define cultural competence? Cultural competence is the ability of the healthcare providers and organizations to effectively deliver healthcare services that meet the social, cultural, and linguistic needs of patients. Cultural competence was also defined by Cross, Barson, and Dennis as a set of congruent behaviors, attitudes, and policies that come together in a system, agency, or among professionals and enables that system, agency, or professional to work effectively in cross-cultural situations. But why is it important to be cultural competent? Diversity is becoming an ongoing trend. Today, completely different cultures cohabitate within the same hospitals and clinics. Cultures influences not only health practices, but also how the healthcare providers and the patients perceive illness. If we are not aware of this, we can fall into what we call health disparities. We call health disparities to the difference in the incidence of disease, disability, or death among racial and ethnic groups. If you don't believe me, I want to give you some facts. According to the Office of Minority Health, under the U.S. Department of Health and Human Services, health disparities cost $50.3 billion in terms of medical expenses from preventable illnesses. The Institute of Medicine's seminal publication, Unequal Treatment, Confronting Racial and Ethnic Disparities in Healthcare, documented that biases, prejudice, and stereotypes held by healthcare providers result in lower quality healthcare provided to racial and ethnic minorities population. According to WHO, infants born to African American women are 1.5 to 3 times more likely to die than infants born to women of other race and ethnicities. American men of all ages and race ethnicities are approximately 4 times more likely to die by suicide than females, and African American men are more likely among all ethnic groups in the United States to develop cancer. What is the value of cultural competence? We know that there is a gap, so as a way to reduce it and enhance doctor-patient communication, concepts like cultural competence are winning importance. The Liaison Committee of Medical Education requires that medical students demonstrate a standard level of cultural competence upon graduation. Culture is a part of an individual that has the power to shape the way that she or he thinks. Thus, understanding the difference is required to increase the efficacy of diagnosis and treatment. Implementing this will ultimately promote impartiality and execution of patient-centered care and safety measures among your facility. How this affects me. RIT is a diverse nonprofit organization that has approximately 50,400 undergraduate students and 3,250 graduate students who represent all 50 states and more than 100 countries. It is estimated that nearly 3,300 students are from diverse racial and ethnic backgrounds, along with more than 2,700 international students. Culturally competent care includes knowledge, attitudes, and skills that support caring for people across different languages and cultures. This will ultimately create a safe, secure, and supportive environment where patients and staff can work together towards increasing the quality of care and decreasing the recurrence of a preventable disease. If you are interested in keep going with this training program, please visit part 2. Thank you.